If you stopped to watch this video at one point, then please tell me what the reason for it was so that I can improve. Otherwise, hi, welcome. I'm trying to learn medicine. Today, appendicitis. And after we've done that, we're going to do leg injury prevention training. And if you participate in the leg injury prevention training, then it's at your own risk. And we're talking about internal anatomy and diseases. And this is no medical advice. I just have the text here to try to understand it. So, appendicitis. We're going over the text. That is the second time we're reading the text. And remember the text and trying to memorize it and making a presentation out of it. Appendicitis. Inflammation of the appendix. Around 10 centimeter long, blind tube arising from the beginning of a large intestine. Okay, there at the point where the small intestine goes on our end of the large intestine, there is a 10 centimeter long appendix. There are two kinds of appendicitis: acute, which strikes suddenly and usually requires immediate hospital admission for an operation to remove the appendix, and chronic, which may continue for months before an operation is necessary. Acute appendicitis. Symptoms. These may develop over 4 to 48 hours, within hours. The first sign is usually pain that comes and goes. At first it may be felt near the navel or sometimes only in the lower right side of the abdomen. Okay, comes and goes. Let's try to say that actually. Pain that comes and goes. Near the navel, a bit on the right lower side of the abdomen, pain. Acute and chronic 10 centimeter appendix. Okay, after a few hours, there is severe constant aching in the lower right side of the abdomen, which is tender to pressure. Tender to pressure. I mean, that's a bit hard, I think. I don't really understand these words. The pain is worse on moving and may interfere with sleep. Okay, after a few hours, constant aching or pain at the lower right side of the abdomen. Tender to pressure, maybe also. The patient feels sick and may vomit. There's often constipation, but sometimes the bowels may be loose or normal. Feels sick and vomit. Sick feeling and vomiting can be possible. Develops after a few hours. First coming and going of the pain. First pain that comes and goes. Then at the navel or at the lower right side, and then after a few hours, constant aching at the lower right side of the abdomen, tenderness or pressure. Food and drink are usually refused. It may hurt to walk around or to pass urine. There may have been a previous similar attack of pain that subsided. Let's try to say that. There may have been a previous similar attack of pain that subsided. The breath may be foul-smelling. The temperature usually rises moderately. Okay, what are the most important ones? Do we try just to say all? Let's try to say all. Okay, we're having the pain developing over a few hours. Then it can be also accompanied with food and drink refusal, pain when walking and passing urine. Previous attacks of a similar pain may have been possible. And a full smell of the breath is also possible, maybe a slight increase of temperature. Duration. An immediate operation is usually needed, after which patients are discharged from hospital within 1 or 2 weeks and can go back to work after 3 weeks. Sometimes the pain will stop after a few hours, but patients should never delay seeking medical help if appendicitis is suspected. Maybe we try to say that it can go away the pain, but if it is suspected, it should be help sought. And after 1 or 2 weeks after operation, the person should be fit again. Causes. The open end of the appendix becomes blocked by kinking, swelling inside the walls, or by a hard mass of fecal material, and infection flares up into an abscess. Okay, it is blocked through kinking, I don't know what that is. Swelling inside the walls. Swelling inside the walls of the appendix can obstruct it itself. And what happens then? Infection flares up into an abscess. So it is itself swollen when it is blocked from that, and that is now an infection, and that can cause a flare-up of an abscess. It is blocked. It can be through a hard mass of fecal material, or do we mean an infection flares up into an abscess? Is blocked, swelling of the walls, hard mass, and when the infection flares up into an abscess. Let's stay with the blocked part. Complications. The abscess may burst, spreading the inflammation all over the abdominal cavity and causing peritonitis. Sometimes the appendix bursts and the spread of inflammation is localized to the appendix area. This is an appendix abscess. Treatment in the home. Let the patient lie still with a hot water bottle to ease the discomfort. Do not give food or drinks. The mouth can be rinsed out with sips of water only. Do not give food or drinks. It's also advised not to give food or drinks. Not pain-killing tablets. When you consult a doctor, if pain has persisted for more than 4 hours, but call the doctor earlier if the pain gets worse, becomes continuous, or keeps the patient awake. Diagnosis of acute appendicitis is always difficult because the symptoms are so variable, so an immediate medical opinion is essential, especially in children and elderly people. Send the patient to a hospital immediately for observation or surgery if acute appendicitis is suspected. Occasionally, if a diagnosis is in doubt or the pain has cleared, the doctor may decide to observe the patient at home. Okay, at hospital we try to examine if it is appendicitis and then the appendix is removed. Prevention none. Outlook. With early observation leading to early diagnosis and treatment, the outlook is excellent. Recurrent attacks of acute appendicitis arise if the appendix is not removed. If it does not lead to a complication with bursting of the abscess and spreading the inflammation all over the abdominal cavity and causing peritonitis. Acute appendicitis, a chronic appendicitis, a condition in which the patient feels bouts of vague discomfort in the right lower abdomen, often for some months. Although acute appendicitis rarely develops, often an operation is performed to see if there are other reasons for the discomfort, but rarely are any found. So it is most of the times bouts of vague discomfort in the right lower abdomen. It is most of the times some form of appendicitis. The appendix is usually removed and in most cases the symptoms disappear. Symptoms: sudden onset of pain, usually in a limb when at rest. Pain in a limb when at rest. The affected limb is colder and paler than the other. Causes: usually is it the same? No. It was arterial thrombosis. I think that the pain in the limb was arterial thrombosis. That was the end of chronic appendicitis. It's just a short. Not right. So it's just the bouts of vague discomfort in the right lower abdomen. The reason for it is most of the time some form of appendicitis. It is possible, but rarely, that acute appendicitis comes from it. But if the appendix is then removed, the symptoms should go away. So it was some form of appendicitis. Appendicitis. The appendix at the beginning of a colon is blocked at the entrance to it, and it can be swelling or the other thing, and that leads then to sudden onset of pain, which goes over for a few hours, gets a bit worse, first coming and going, and then pain that arises at the lower abdomen, and the person maybe refuses drinking food, and the person should also not get food or drink, also no painkillers, and it can hurt to walk around, pass urine. There may have been a previous attack which had subsided, but breath can be small and the temperature has risen. And an operation and the person should seek immediately medical help, and then it's examined if it is appendicitis. If it is, then an operation isn't necessary, the appendix is removed, so that it does not come to the bursting of the inflamed part and spreading of the inflammation into the abdominal cavity, causing peritonitis. Peritonitis. It's not here. Peritonitis. Inflammation of the peritoneum, the membrane that lines the abdominal cavity surrounding the stomach and other soft internal organs. Peritonitis is an acute and always serious condition which follows inflammation of other abdominal organs. It can be a complication of a burst appendix abscess, a burst gastric or duodenal ulcer, a rupture, ectopic pregnancy, or any ulcer which perforates the wall of the bowel and allows the intestinal contents to escape into the surrounding abdominal cavity. The presence of infected material and pus outside the bowel paralyzes all bowel movements and can cause death in 1 or 2 days if not treated. Peritonitis. Spreading of inflammation to the peritoneum that lines the abdominal cavity and can, without treatment, lead within 1 or 2 days to death. That's why someone has to go with appendicitis to hospital. What are we doing? We're doing as a fitness bond. Ladies and gentlemen, let's not rush it. We're having a good video prepared. We're having a lot of information good together. So let's not rush it. Let's go to the medical part. If you were here for medicine, you can go directly to the next part of medicine, where we will do appendicitis again, and then we're going to try to make our presentation video about the appendicitis properly. This was no medical advice, the whole thing. If you stay here and participate in the leg injury prevention training, then is that your own risk. Have a good standing leg and swing one leg to the side in the front. The goalkeeper preparing for the goal kick exercise. Upper leg, front. And point the front of the foot and back. Other foot and front and back. And one leg, upper arms up. Go with hands over to one side with knee over to the other. And change it. Middle and down. Hands up, leg up. Hands over to one side. Hands over to one side. Knee over to one side. Change. With distracted boy exercise. Middle and down. The bolt lock. Leg up and press with the knee up and to the side. Other knee. Up. Side. Okay, the next exercise. The white cat. Stand good on one leg. This exercise can go onto the knee. Turn over to the side. Go down to the knee. Slowly over. Other leg. Stand good. Turn over. Down. To the other side. The clock. Stand good. And go with the heel always, the knee goes always a bit down, to 90-minute intervals on an imaginary dial. Other leg. 12 o'clock and 1:30 and 3, 10:30 and 9, and also 6:30, 7:30 and 6 and 4:30 and 3. Next exercise, the pipette. Don't do it if you're pregnant. Heel onto the ground and lift it heel off the ground and place it again onto the ground. Other side. And the stamp. Leg up and down. Other side. And the horse. Leg in and out. And the camel, the whole body goes up and down. You can do a step horse. And number one, now our whole leg swings back. And one last one. And the other leg. First the horse, leg in and out. And the camel, whole body moves. And the other one, the whole leg swings back. You can do instead horse or something else. Legs out apart and we're closing. Breathing out. Breathing out. One more round, breathe in. Hold it. Breathe in, close the legs. And breathe in out. That was the leg injury prevention training. I thank you very much and until next time.